Welcome to the Together We Thrive Birthing Services podcast. I'm Lindsay Dyer. I'm host of LD Aviation Podcast, and I'm excited to continue to bring to our listeners this special offshoot of our brand, Together We Thrive Birthing Services. So this initiative was born from a passion for supporting aviation families through all stages of parenthood, from pregnancy to postpartum care and beyond. So we know that navigating birth, recovery, and parenting can be overwhelming, especially for those in the aviation industry with unique schedules and demands. So our goal is to connect parents and families with experts who provide valuable insights, support, and holistic wellness solutions. So as part of our commitment to empowering families, we bring in experts across various fields to help educate and support expecting parents, new moms, and those caring for newborns. So today we have the pleasure of speaking with Dr. Taylor Langdon, a highly skilled chiropractor specializing in prenatal, postpartum, and infant chiropractic care. Her passion for holistic wellness has helped countless mothers experience more comfortable pregnancies, smoother recoveries, and improved well-being for their newborns. But Doc's expertise doesn't stop with humans. She also specializes in chiropractic care for animals, which I think is super cool also, ensuring that our beloved four-legged family members receive the same level in care and attention. So in today's conversation, we'll explore the benefits of chiropractic care for expectant mothers, how adjustments can aid in postpartum recovery, why newborns can benefit from chiropractic care, and even how these techniques extend to animals. So whether you're a new mom, an expecting parent, or simply curious about the power of chiropractic care, this episode is packed with valuable insights. So let's dive in. Welcome, Dr. Taylor.
Hello. Thank you for having me.
So great to have you here. We're going to dive in with kind of some background questions here. So Dr.
Perfect.
Taylor, can you share your journey into chiropractic care?
Yeah, absolutely. So I first started kind of getting interested in chiropractic when I was in college. I kind of was one of those people that didn't really know what they wanted to do. Like after college, I went in as a biochem major thinking I wanted to be a dentist, and then I switched around. Then I thought I wanted to be a vet, and because I grew up riding horses and rodeoing and then college rodeoed, so I thought I'd just stay in that realm. And so when I was riding my horses, I came about this animal chiropractor. He went to school at Oklahoma State University, so he was up in Kansas, so I would travel with some friends and we'd take all our horses and kind of make a day of it. And he would go and adjust them. And I just thought it was the coolest thing ever. I was like, this kind of seems like the best of both worlds because I'm still around the animals, but I wasn't like totally aligned with, when I would go to the vet and they would really push like injections, steroids, and kind of masking pains and symptoms, and not really like going into the root cause of what was going on. Whereas when I took my horses to the chiropractor, he was fixing the issue, not just masking it, and helping me along the way as well. So anyways, then he started adjusting me, and I immediately noticed not only a difference in my horse's performance, but my own, because there's such a connection, right? So that just really made me deep dive into the field. And basically the rest is history. Like I immediately switched it up, applied to chiropractic school, went through that whole process, and got in and went to school.
Ah, that's awesome. Okay. And so now you work a lot with pregnant women and postpartum.
Mm-hmm.
So what inspired you to specialize in the whole pregnancy part, newborns? And I guess we understand why the animals part came in. But...
Right. Yeah. Honestly, when I was in chiropractic school, I didn't, that field with the prenatal and postpartum and pediatric side of chiropractic didn't really like speak to me then. I was like kind of honed in because I was a college athlete. So I really was like, oh, I kind of want to be a sports chiropractor. And then of course, getting the animal chiropractic certifications and stuff like that. So it wasn't until my internship. So kind of the last like 4 or 5 months of my time at chiropractic school is our clinicals. And so I'm originally from Texas. My fiance's from Winters, California, where we're at right now. And so, yeah. And so I found a place in Roseville who accepted interns through my school. And so I moved out here, which was the plan anyway. So I just moved out here a little bit earlier and started my last 6 months of school at this wellness center called Lighthouse Wellness Center there in Roseville. And they're very, very connected to the California Birth Center. And so majority of the patients that I was seeing were pregnant or postpartum, or of course, then they would bring their babies in as infants and then growing up. So I was there for almost 2 years, and just immediately for the whole internship, I just really got my hands on it, and I just fell in love with not only just basically seeing the circle of life with that, with just a mom coming in, she's trying to get pregnant and she's telling me that we're getting her, her aligned and stuff. And then her coming in and I know saying, oh my gosh, I'm pregnant. And then us going through that 9-10 month journey of her getting the prenatal care that she needs. And then of course, labor, delivery, baby, and then bringing the baby in. And I just fell in love with that circle of life and seeing all that transpire over the months. So I wanted to be a part of that journey. So I went through the certifications needed to become certified to treat pregnant women. So that's kind of what got me into it.
Yeah, it's very inspiring. It's so funny how, just small little tweaks in our life change the long-term trajectory of everything.
Exactly. Yeah. No, it's been awesome.
Well, okay. So you touched a little bit on the fact that you had to do an internship, but what other types of training do you have to become a chiropractor?
Yeah, so you have to have a bachelor's degree. So, going to school, getting your bachelor's for 3 to 4 years, however long it takes you. I did 4 years at Oklahoma State University. I graduated with a bachelor's in animal science and a minor in business. You really just need to get those prerequisites for chiropractic school. So a lot of people are like, oh, you're animal science, but you treat humans. But I did do the extra classes in order, like human anatomy and human biology and stuff like that. So a lot of my classmates in chiropractic school had bachelor's in kinesiology or biology or things like that, or anatomy. So whatever you can get to get those prerequisites that can then get you into chiropractic school. And then chiropractic school is a doctorate program. So it's 3 to 4 years of schooling, with that last 6 months being the clinical rotation side of things. So I went to a school in Dallas, Texas called Parker University, and they have a doctorate of chiropractic program. So that's what I did. Graduated in December 2022 with that, and was already moved out here because I had to finish my clinicals out here. So then I just started working right after that. But then I went a little bit further and I got certified through the ICPA, or the International Chiropractic Pediatric Association, to become Webster Technique certified. So Webster Technique is specific for pregnant women. It's a prenatal adjustment treatment that really, really hones in on your pelvis and your sacrum and kind of the ligaments and tendons and muscles that all connect around that area. So definitely recommend, if you are seeking like prenatal chiropractic care, definitely do your research, go to the icpa.com website, and there's the whole referral list that you can look up, type in your zip code or your city, and it'll pop up Webster-certified chiropractors in the area.
Okay.
So totally recommend that. So I went through that, did that extra certification. And then for the animal side of things, I went kind of not through school. I went like outside of school and did like kind of an external rotation at this animal chiropractic certification, which is called ACEs, or Animal Chiropractic Education Source, and went through that and got certified to treat animals through there. So those were kind of all separate, not through school. You kind of have to go outside, but I was really lucky because I was able to do those while I was still in school. So that worked out that once I graduated, I was done. Okay. So that was good.
But wow, what a lot of school. So you're talking it feels like almost a decade, but at least 8 years of
8 years.
School. Wow.
Yes. Yeah. It was a lot of school. It goes by pretty quickly, but you definitely need it to make sure that obviously you're safe, your stuff. And then if you are trying to get those extra certifications, then going through all the classes in order to know exactly how to treat those types of people or animals.
Very cool. Well, great. Well, I'm really glad that you are in our little town of Winters. So
yes, me too.
That's awesome. Okay, let's kind of switch over to some of the actual chiropractic care that you do. Yeah. What are some of the key benefits for an expectant mother?
Right. So I always explain to my moms, which a lot of them already know this, but you have this hormone when you're pregnant called relaxin. And so it gets stepped up as you continue your pregnancy. Relaxin is a hormone that makes you loosey-goosey, kind of, which is awesome for labor, right? And delivery, because we want to be as loose as we can. We want all those areas around your pelvis to be able to open up and allow you to have a nice birth, nothing too tight. So I always say it's really great for that, but during pregnancy, it kind of goes against you because you want to feel stable, you want to feel aligned, but you can do one quick movement, and because of the relaxant, you get kind of tweaked up, or that's when kind of the discomforts start coming about. For specific benefits for that, obviously getting adjusted, one of the biggest things we do is try to help with stability. So if a mom comes in, let's say, with round ligament pain, so like lower abdominal pain, pubic bone pain, those kind of go hand in hand. Or lightning crotch is what a lot of moms come in and say, I got the lightning crotch pain. It's most of the time because that pubic bone is not in the correct position, or what we would call out of alignment, or in a malposition, so not in a correct position. And we go in and adjust that area to make it line up better, which then fast forward to when she's trying to, like in labor, that's going to give the baby a straight shot down. So there's nothing in its way, and we're hoping that baby can just easily go down, drop, and then happen. So that's just kind of one of the benefits of it. Of course, a lot of studies show that it's going to reduce labor times, getting your prenatal chiropractic adjustments. It's going to allow for baby to be an optimal like environment in the womb. A lot of studies show that. And again, I always correlate these, just so I don't have to repeat myself. This is when doing Webster. And so I have a lot of moms that come into me and they're like, well, I got adjusted during my pregnancy, but it was not Webster. And there's a huge difference between a Webster technique adjustment and just someone that's coming in and getting adjusted, like, you know, Joe off the side of the road is coming in to get adjusted. I'm not adjusting him like I'm adjusting a pregnant woman in my office. So that's why it's really important to get Webster technique adjusted, because you really are going to find those beneficial signs that most moms need anyways when pregnant.
That's a good point. Okay, so we need to be looking for Webster-certified.
Yes. Yeah, and just overall, I mean, the basics, alleviating tension, trying to increase your comfortability. Pregnant moms, you know, their center of gravity is thrown off completely. So when they're pregnant, and of course, as baby starts to grow. So just being able to kind of flow with the body and help with like compensating. I always bring up, and this is pregnant or not pregnant, but we'll stick with pregnancy, you know, we can go through life and our gait be off and we don't even realize it. And it's actually because of a leg length discrepancy. So a lot of my moms that come in, they're going to have like one leg that's longer than the other, shorter than the other.
Sure.
Of course, they come in and they're wobbling or something like that. And I'm trying to get their leg lengths the same, which isn't, again, their legs. It's actually coming from their pelvis. So again, bringing Webster back into it is adjusting that pelvis, can help properly sit your pelvis correctly. It's going to help with tailbone pain, and then it's going to make you feel more stable. And of course, hopefully like walk a little bit more stable, and then feel more comfortable moving and grooving and doing kind of your daily activities.
Okay. Well, you kind of mentioned, you know, back pain and pelvis, and what about the sciatica? So that seems, thankfully, I didn't ever have any issues with that, but I know a lot of moms have issues with sciatica.
Yes.
Can you help with that?
Yes, absolutely. So that's kind of like a perfect segue into that when I was talking about the pelvis and how it can get off kilter.
Okay.
What sciatica is it's a nerve, sciatic nerve, and it comes from your lower back. So really, really low part of your back. It comes out from the spinal column, and it then goes down through your hip. So a lot of people will come in and they'll be like, my hip hurts, you know, in the back, you know, kind of where that divot is, and kind of my buttocks area or glute area. And then it runs down my leg. So that really like speaks to me as that's a sciatic nerve. It's coming from the spine. It's going through this joint called your sacroiliac joint or your SI joint, and then running down your leg. And a lot of the time, either a pregnant mom's tailbone or pelvis is going to be out of alignment and it needs to be adjusted. And then that nerve that's being pinched will alleviate, and that space will come back. I also do kind of a lot of like traction or like decompression of the spine, also to help with that sciatic nerve. So yes, I mean, every day I have pregnant or not pregnant people that have sciatica, and a lot of that is due to maybe prolonged sitting or tweaking your lower back, doing a weird lift or twist. But with pregnancy, because of that relaxin hormone, things shift so often that sciatic nerve, even if you don't have a history of it, is going to get pinched and cause that. So getting adjusted alleviates that.
All right.
So that's kind of how that works.
That's great. Very cool. I'll share just a quick story. So no, I didn't ever get adjusted with you when I was pregnant, but for my first two, my back hurt so bad after the pregnancy.
Oh my
And
gosh,
that
yes.
was just miserable. Anyway, and
Yeah.
I think I went for a couple of months and
Mm-hmm.
fixed it all up. So I'm like a huge
Yeah.
believer in the fact that chiropractic care works.
Mm-hmm.
But I wanted to bring up, some people are like, oh, I'm not going to go to chiropractic care because they're nervous about it. So are there
Right.
any misconceptions about chiropractic care that you could clear up for us?
For sure. I mean, that's one of the biggest things is it safe? I kind of jokingly say, like, shop around for your chiropractor. I have, since opening my practice in Winters, before that there wasn't a chiropractor in Winters. So I had a lot of people once I moved here say, I was having to go to this person or this person, and I had to shop around, and then nothing worked out. And then now you're local and they're wanting it to work out. But I always say again, go to a Webster-certified chiropractor, but make sure to go to someone that you feel comfortable with. I think that that's one of the big things is it's kind of like a dentist, like, oh, I get this dentist and then I got to stick with this dentist. Go to someone that you feel comfortable with, and that will help better your experience. As for safety wise, again, make sure you're going to a Webster certified chiropractor, but also just know that whenever we're doing things, we went to school for 8 years, so we really know our stuff. For me, one of the biggest things is I'm like an over explainer. I don't like going to my, PCP or, my GP or something and talking to them about like a complaint and them just being like, okay, take this and you'll be okay. And I'm like, but why is that? So, and maybe it's just the nerd in me, but I really like explaining, okay, this is what I find in your body. This is how this can correlate to your symptoms. And this is how I can fix it. And if I can't fix it, let's find you somewhere else to go or something else for you to do. So I think that's a big misconception about chiropractic is that we're just going to crack your back and then let you leave after 5 minutes.
Okay.
For me personally, that's not how I do it. Your appointments are one-on-one, very long appointments, especially when you're pregnant. They're extra long because we have to go through all the Webster. Even sometimes, especially when you're pregnant and you get a little bit farther along in your pregnancy, you probably won't even hear any cracks or pops because I'm doing everything very neutrally, very safe, very gentle, using different tools I have in my office to do the adjusting instead of my big old hands. So I think there are so many misconceptions, and at least for me, I'm always trying to squish those. And I do get a lot of feedback that like it is very rare for people to have long appointments and people that explain it. So I just encourage people to find what fits them, and find someone that's going to make them feel comfortable and heard.
That's a good point. Yeah. And I actually had no idea it was at least 8 years of training in there. So which is great. I think a lot of people must not know that. So.
Right. Yeah.
Crazy.
Exactly. And I think like another misconception is the popping and the clicking. So I'll take this opportunity to explain that. Just because it's not that crazy. So the popping that happens, if you see the crazy like TikTok videos that people post and it's a lot of noise, sometimes it can look like very forceful. Again, some people are like that. Not me, but the popping is not bone on bone or anything like that. It's actually gas releasing. And so there's pockets of gas in the joints, and that's actually what we're adjusting. So a lot of people will be like, oh, she cracks my bones, or, she pops my back or my neck or something like that. I'm not moving bones, I'm working on the joints. And so that pop or that release of tension that you might hear or feel is the joint, not bone. So it's very safe. For me personally, I'm very gentle, and I'm also not an over adjuster. I'm not going to adjust an area and just to get a noise out of it.
Okay.
Because sometimes you won't, and then so like what's the point? So I always evaluate the area before I adjust. And if I'm like, oh, it feels really good, then I'm good. I'm gonna pass it.
Okay.
But I always check full body. So yeah.
That's a good point. The popping never bothered me, but I guess I never really paid attention to what it was either. So it's just the gap in between the joints.
Yes.
Very cool. All right. Very cool. All right. Well, we touched on this a little bit more, but let's move into like postpartum or new mothers after the giving birth. And I'll say it was huge for me. What is it important for new mothers to get adjusted?
Right. So I always like to say, like when my moms come in postpartum, there's a lot going on. Not only, well, I'll back up. We always say that there's 3 T's, okay? There's in their traumas. 3 traumas is what I'll call it. physical, mental, and chemical. So if you think about physical trauma, I mean, labor and delivery is very traumatic, right? Not only physically, but mentally and emotionally for the moms and the baby, but we'll get there. Specifically for the moms, not only just getting adjusted to help with physical things, it also helps with mental and emotional. One, you're taking that, or 20 minutes, 30 minutes, whatever it is, to do something for yourself. So that's one side of it, is coming in, maybe having baby, but baby's asleep, or someone's with baby while you're in getting treated, and taking that opportunity for yourself. So that's just self-care. So that's helping with mental and emotional. You also have the relaxin. So you still are going to hold relaxin in your body for up to a year to 18 months, I think is what it is. So things are going to definitely be out of whack, is what they say, just due to giving birth. And so just getting that TLC, getting that postpartum adjustment, it's going to alleviate some discomforts. It's going to place your body back into its correct position. And what I usually recommend for my postpartum moms is, well, one, take your time coming in. Don't feel like you need to come in 2 days after baby's born. I always encourage my moms, which I know it's way, way easier said than done, take 2 weeks to spend with your baby, to not leave your house, to eat really good foods, hydrate, get your body back up and at it. But I mean, you're still having to go through a lot because you have a newborn. So I always say about 2 weeks, come in for your postpartum adjustment. If it has to be longer, then that's okay. I'm here when you need me. But it is very beneficial to come in, as soon as you can, to help alleviate some of those aches and pains. I'm also going to kind of, even though Webster is a prenatal chiropractic, I do still check pubic bone, round ligament, those areas that might feel a little bit icky or sore after an adjustment. I'm going to kind of go back and check those. So I am still incorporating Webster even after baby's here. And then we can start kind of just going to like still doing full body adjustments, but kind of getting away from Webster.
Okay. Interesting. I'm kind of curious too, like what other are common postpartum concerns? Like, I know for me, looking down at the baby now is a position I wasn't sitting in very often.
For sure.
The shoulder, is that something?
Oh yeah. One of the biggest things that I have my moms come in, they're like, I've never had, upper back pain or shoulder tightness or neck pain. Headaches are a really big one. Postpartum headaches, because all your hormones are readjusting and things like that. So that can cause tension, headaches, but also just the looking down as well. So yeah, absolutely. If it's breastfeeding or bottle feeding baby, I get a lot of dads into, I'm having to hunch my shoulders over and look at baby all the time, or pick up baby. And I'm like, yeah, come in and get adjusted. We have ribs in our body, which most people know, but even your first ribs are right here. And so a lot of the time, just because either laying on my mom's laying on their side feeding in bed, they're having to hold a shoulder up. And so then they can start to get either shoulder blade or upper back discomfort. And that can be from a rib being out. So that's something that I can get adjusted, as well as alleviating any like neck tension. And that's a really big one. So yeah, you're exactly right. That's one of the biggest ones, is position wise. And then having to, sleep in a chair instead, or feeding in a chair for long periods of time. So yeah, that's a good one.
And you're like, try not to move, because if you move, you might wake up. You're just
exactly. Yeah. You're like, I know something, my back is not happy with me right now, but I'm going to do everything I possibly can not to wake baby up, which I totally get. We got to do what we got to do, but that's just when I come in, I can help you with that. Alleviate some of those.
That's great. Very cool. I need to make an appointment with you too.
Yeah. Come on in.
Cool. All right. So let's then move on to the newborn side of it. And I've heard some great stories, but let's just establish, like, most people didn't even know that newborns can get chiropractic care. So, yeah. Talk about
that. Like, kind of going back, I mean, not only is the birth in itself really traumatic for moms, it is for baby too. Their whole environment is changing. They were just in this little nook, happy and warm, and then boom, they're out. And it's amazing, and it's a miracle, and it's so special, but it can be hard on them, especially if you're gonna have like a really quick labor. So things are which we love, but it's also pretty quick for baby, and so that can lead to some issues as well as like rigidity. Again, their diet is changing. So one of the big things that I get seen in my office right off the bat is, oh, my baby's not either is very fussy, not wanting to eat, or not necessarily eat, but doing like cluster feeding, maybe eating like an ounce or something like that, and then, not wanting any more. So that's kind of when I can come in and look at like their digestive tract, which is not me literally looking at their digestive tract, but I'm honing in on doing some body work for their tummy area, their abdominals. I always like to explain we have this ileocecal valve, which is a muscle in our stomach that can get blocked if it's due to a diet change. So obviously then coming out in the real world and having, if it's, milk or bottle or formula, whatever it is, from mom or not from mom, that's a change in their diets where that can cause that blockage to where then they can get colicky symptoms, constipation. Of course, then that leads to fussiness, gassiness, and acid reflux is a really big one. So working on that area is really beneficial for babies. When it comes to rigidity, that is more. My baby's coming in and it can lift its head at a week old. My baby's really strong. Well, that actually is not normal, right? We actually want baby's head not to lift at all, especially at 1 year old. We don't want that to happen until I always never like to give a timeline because then my mom's hone in on timelines. Sure. It's like the milestones. I'm like, don't worry. The milestone, so I never really like to give a timeline because every baby's different. But if your baby's lifting their head after a week of being born, that is a sign of tension in their spine, rigidity. So getting adjusted in their spine can really help that area and them calm down and relax.
Okay.
Torticollis is a really common sign of something very common that can happen just based on position on either how they came out of the womb or if they spend a lot of time looking one way. Let's say they're in their bassinet and they're only looking to the right and they refuse to turn to the left without crying and showing signs of rigidity. That's something that I can get adjusted and helping them with their range of motion as well.
Cool.
That I always like to explain, and this is for anyone, but parasympathetic and sympathetic, those are two nervous systems.
Okay.
Sympathetic nervous system is our fight or flight. So baby comes out, where cortisol levels are high, we're fight or flight, crying, upset, tension can arise, things like that. When you get adjusted, and that kind of plays along to just like this traumas and stress that we have. When you get adjusted, our parasympathetic nervous system turns on. That is our rest and digest. So obviously as a newborn, we want them to sleep. We want them to be comfortable. We don't want them to be tight and tensiony and fussy, which is them and their sympathetic nervous system. And obviously we want their digestion to be normal or consistent. So, didn't have a bowel movement for 2 or 3 days, things like that. Because then that's no fun for really anyone.
No,
so
right.
For a baby. So I always like to play into that and let people know that not only adjusting is really good for physical reasons, but it's correlated to your nervous system. So it's going to help with nervous system development. And there's so many studies that show that getting adjusted at a young age helps with your growth and brain development, helping regulate your nervous system. There's a lot of studies that show that getting your toddler, young kid adjusted at an early age can help with symptoms like ADHD, ADD, things like that, anxiety, depression. I know we're not worried about that as an infant, but obviously that infant is going to grow into a toddler and a little kid and then a teenager. So getting them adjusted as early as can have all of those nervous system regulation benefits as well. So, yeah.
Very cool. Okay, so but what can you tell us, what does that kind of look like? So I know what it looks like when I go to a chiropractor, and I'm laying on my stomach or something, but you might have this itty bitty tiny baby. What does that look like? What should we expect?
Yeah, so right. And I get that question a lot, how in the world do you adjust a 5-hour-old baby? So it's I'm honored to be able to do that. I just think it's the coolest thing ever. And I'm so lucky to be in this field, to be able to be one of the few people right off the bat that gets to help this baby and get them more comfortable in this new world. But a lot of it is, yes, with my hands. It's very slow. It's very gentle. There's no quick movements. There's no popping or cracking bones or moving anything very fast. What I like to call it is kind of a little bit of vibrational movements, a lot of steady holds, a lot of moving the body really slowly and getting them into the position and then doing the adjustment. As they get older, usually around that 3 to 6 month period is when I start implementing this tool that I have called the activator. A lot of people know it as the clicker. I don't have it with me or I would show you, but that's another really nice way to adjust the baby without using my big hands to do the adjustments or like the quick movements. It's using that very precise tool instead to get those adjustments that are needed in the body. But I also implement a lot of body work, like I was saying, for the stomach, and doing a lot of mobilization in that area. And even though my parents have a lot going on, I'm also going to most likely give them homework because, you know, I'm going to see the baby maybe once or twice a week starting out, depending on what's going on. So we need to be doing things daily, maybe a couple of times daily, to really help get things nice and loose or moving and grooving, like if they're having like some constipation issues and things like that. So I really do implement a lot of like exercises and stretching, and for my parents to do at home to also help baby.
Homework. I love it. Yeah.
Yes.
That's awesome.
I'm always giving homework to my adults or to my babies or whatever it is. I'm like, we got to do this to get this better.
Well, that makes sense. I mean, really, it's not like one time is going to fix it. Like we move our bodies every day. We bump stuff or get it out of alignment every day.
Right. Yes. Yeah. One of the biggest things that I work with, especially with my newborns or infants, is a lot of babies will come in with tongue ties. Sometimes tongue ties have become a little bit more frequent as in the last few years. No, there's a lot of, not conspiracies, but some people say it's a diet, chemicals, whatever it is. So I work really closely with lactation consultants. They find the tie, or even if it's like a nurse or a pediatrician, they find the tie and they recommend, going and seeing a pediatric dentist, getting an evaluation with them. Pediatric dentists, oh my gosh, are really, really good at referring the babies in for chiropractic care. The reason why is, I don't know if you've ever like had your jaw out of alignment or had like TMJ pain or anything like that, or popping and clicking in your jaw. Those are very, very much related to having a tongue tie, either when you were little or growing up. And so getting your jaw adjusted either pre or post tongue tie revision helps one with the healing process, but it helps those symptoms of a poppy jaw, sleep apnea, reducing mouth breathing, which helps with then benefiting your immune system, because then we're not getting yucky germs in, as well as like reduced likelihood of lockjaw, things like that. So again, getting adjusted when you're little can benefit you in the future with trying to reduce the likelihood of those symptoms from appearing. So I treat a lot of tongue-tied babies in my office and work really closely with the dentist and lactation consultants on helping with that, getting ready for the procedure, and then post revision and helping the healing process, things like that.
So many uses. I had no idea you could help with that as well.
Mm-hmm. Yeah.
That is so cool. Okay, so how would we decide if we should bring our newborn in? Are there any telltale signs, or should everybody go?
I mean, everyone should go, honestly. And I get that question a lot, is how do I know if, my animal or my baby or I need to be adjusted? And I'm always like, I'm sure I'll find something, bring them in. I always recommend, even maintenance adjustments. So for my babies and infants kind of going up into toddler, and then like young teen, obviously they have less stressors than an adult patient. They've had less traumas to their bodies. So I would recommend every like 4 to 6 weeks. And then once we hit kind of that like upper teen and then on, that's when I recommend that every 4 weeks adjustment. So I have people that come in to my office and they're like, I feel great this month or this week. And I'm like, that's fantastic. Let's keep it that way. And so chiropractic is not only for fixing like acute and chronic issues that are happening right now, but it's also really good for preventatives. So specifically for my newborns, if it is like an acute injury or complaint, which acute is, it just happened. So let's say it's like torticollis. So, they have a wry neck or their neck stuck one way. Let's treat that, and then let's not let that happen again. So let me keep up with the adjustments, making sure they're not going to be prone to have that happen again, and then follow them later in life. And then as well as, like I was just saying about the lockjaw, like TMJ, aligning the jaw now reduces the likelihood of TMJ pain happening later in life. So it's really, even though, you could say, I feel totally fine, I have no complaints, and my baby's as healthy as can be, that's amazing. Let's keep it that way. So that's kind of what I recommend for everyone, is come in, get adjusted, and you'll be able to see the benefits follow you way, 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 way down the road.
Excellent. All right. Great. All right. So we've kind of talked about pregnant moms, postpartum, and newborns. Let's switch over to the animal side of that.
Yeah.
Was that, I think you told us during the original part of your training, you did kind of knew you wanted to go into this right kind of from the beginning, the animal.
Right. Yeah. The animals. Yes. Yes. Yeah. I grew up riding horses competitively. I did barrel racing and a couple of other events. And so right away, when I started getting my horses adjusted, I knew that it was awesome. So it helped not only with like their performance, but it also helped with their like recovery times after performing, and then as well as actually fixing problems. Like I was having to have a horse get injections into his hind legs at first it was, every 6 months, and then it was every 3 months, and those are expensive. So I was like, okay, what is going on? Like, why is this happening? And it's again kind of going back to that pelvis. He was wearing and tearing on his pelvis that it was out of alignment. And so getting the pelvis adjusted helped alleviate some of that tension and pressure that was happening on his knees and ankles. And that's where the injections were happening, to where he wasn't stiff after performing. His mannerisms were better because he wasn't mad at me. Because he wasn't hurting, as well as just like again, kind of going to the mannerisms. I had a really, really anxious horse in college. He was kind of crazy, but getting him adjusted put him in that parasympathetic state, that rest and digest. And so he had like really bad separation anxiety and like performance anxiety. But then when he was actually running, he was really good. So I kind of just dealt with it. But getting him adjusted really helped with both of those. And so I just thought it was so neat to not only help with the physical things, but the mental side. And then as well as then it helping with me as well, that I was just like, oh yeah, this is it. I've
got horses as well, although I really was never competitive about that. But I'm curious about like digestive issues or even older horses. I have an older horse now. Anything that can help there?
Oh yeah, absolutely. I mean, chiropractic, again, starting it earlier when the horse is later, it's going to help with that stiffness. It's going to help with their gait. It's going to allow them to just be more comfortable in their body. I don't know if you notice, like for your horse or the older horses, they like to like kind of like let a leg kind of what do we call it? I kind of call it like a sleepy leg, or they lean on one leg. And then they can switch. That can be a really big sign that they're uncomfortable in their hind end or their back. So they're just trying to do anything to alleviate some of that pressure. We do it too. When we stand, we kind of toss a hip out. That's again to kind of compensate for some tension maybe in our low back or our hips. So even for my animals that come in with already being diagnosed with arthritis, people are like, well, can you do anything about that? I can't necessarily like take away the arthritis, right? But I can help with the uncomfortable like symptoms that it brings with stiff gait, not being able to play or walk or things like that. But as well as just helping with, again, kind of going into the mental side of things. You want them to be comfortable enough to move their body. So for my older animals, I get a lot of, well, he's sleeping a lot, or he doesn't want to play, or his mood is down. Well, it's because he's not feeling comfortable enough to play or walk or perform. So getting adjusted allows them to then, their energy is back up. They're feeling better about themselves. They're moving their body more to where then they can go on those walks and get that fresh air and that vitamin D and all of that stuff. Mm-hmm. So I get a lot of, oh, my dog's too old. There's no saving it. Or, or my horse is done. He's retired. Just because your animal isn't performing or is old doesn't mean that he or she does not need an adjustment to help just with making them have a better quality of life, basically, and trying to have them have like a long longevity and things like that. So I'm always trying to increase people's quality of life. I say that all the time is, even for my old patients, all I do is sit at home. I'm retired. I don't want to do anything. Let's increase your quality of life. So that's a big motto for me.
Well, that's wonderful. Yeah. And increasing the quality of life without adding additional, maybe medications, injections.
Exactly. Mm-hmm. Exactly.
Have side effects. Yeah.
Mm-hmm. 100%. Yeah.
How does the chiropractic care compare between or look like in animals versus humans? Again, we talked about the pregnant moms and the babies, but now do we bring our animals to you? Do you
Yeah.
come to the animals?
Yep. So it depends on the animal. So my small animals, which are like my dogs and my cats, they come into my office.
Cool.
And then for my larger animals, so my horses, my donkeys, my cows, my pigs, I go to you. I don't want your large animal in my office. So I don't think downtown winners would appreciate that.
Probably not.
Yeah, so I go to the animals. I have this really tall bale, like styrofoam bale that I stand on. So I get that a lot. How do you adjust a horse? So I stand on that to get above them to deliver the adjustments to them. A lot of their, I get, how do you adjust a horse? I always use the force equals mass times acceleration. So people are like, oh, you're small or whatever. I'm tall, but I'm not a big old muscular man or anything like that. So how does that happen? So I always say that speed is kind of on my side of things, not necessarily saying I'm doing like really like quick adjustments, but it's all about precision and then the speed that you deliver it in and not as much the force. And I think that benefits me for not only my animals, but my like human patients as well. Is a lot of people will tell me, well, you're really gentle. I'm not having to like grunt or oof in pain because you're so forceful. I'm pretty quick. And so I think a lot of people really like that technique because again, they're not feeling like they're getting just beat up on. And I find that my horses even really appreciate that. They might be big, but I like adjusting the animals because they don't hide their emotions like human or people. They'll tell us right away what doesn't feel good and what does feel good. So when an adjustment happens for, let's say, a dog, a really common thing that they'll do is do like a full body shake, or they'll start salivating or yawning, and it's just them coming down from that. And like, gosh, I was in pain, getting adjusted and kind of coming down. Again, that parasympathetic is like bringing down those cortisol levels and being more comfortable in their bodies. The horses are the same way. They'll shake, they'll yawn, they'll put their head down. A lot of the times they'll come closer to you because they're like, oh my gosh, she's helping me. Sure. So I really like getting that feedback immediately from the animals. Not only is it just really, really reassuring to me that, oh, like that was good and they really needed that, but it makes me feel good to help them, right? So they're pretty quick to respond and find really good benefits from it just like immediately, which is really cool.
That's very cool. Can you do, okay, this is a funny question. What about a bird? Like, have you ever done a bird?
I haven't done I've done a chicken. So I don't know if we put that in the realm of bird. A chicken's a bird. So yeah, when I was doing my like certification class, I adjusted a chicken. So that's as far as I've gone for birds. I've adjusted a lizard. People joke and are like, what about a snake? I'm sorry. I'll stop there. You won't see me adjust a snake. Lizards. I was just adjusting some mini donkeys the other day, mini ponies.
Oh, okay.
So that's also really cool because, when I'm in my office, obviously it's inside, in four walls, and I really like being able to go out to the pastures or the barns, either on the mornings that I'm off or during the weekends when I'm not in my office, and kind of be able to be outside and change it up a little bit and adjust the animals. So, which I've been around my whole life, so I love being around them.
That's so cool. That's so cool. Awesome.
Yeah.
Well, let's see. I want to move into kind of some questions that a lot of people might have. Are there any questions that you get asked a lot that we didn't cover today?
Let's see.
That's about a lot.
I mean, I get asked a lot, like, we kind of went over this, like, why does someone need chiropractic care if I'm not, if, they're not having any aches and pains. I had a mom in, 2 weeks ago, and she was like 39 weeks and 4 days. Thankfully this was her second pregnancy. And she was like, I have been like no issues during this pregnancy. Everything's been feeling really, really good. But her doula recommended she come and get adjusted before she had her baby. So she did, and she loved it. She was like, oh my gosh, why didn't I come here sooner? Just to get those moments to herself and getting what she deserves, that self-care, getting that adjustment. But also just then she had her baby like 2 days later, and it was really quick and nice and perfect. So that's kind of sticking with the prenatal adjusting, like even though you might be feeling really, really great, which is amazing, it can help with the benefits of labor and delivery and then postpartum healing and things like that. Same with my animals. I get asked, why does my dog that is a lap dog need to be adjusted? Well, does your lap dog jump in and out of your car or on and off your bed all day, every day? Yeah. Well, that's really hard on their joints. It's hard on anybody to, jump out of their car. It's hard on their knees and stuff. So getting adjusted can help decrease the likelihood of hip dysplasia from happening for your animals, like my German Shepherds, dachshunds, really common IVDD or the disc issues. So reducing the likelihood of those. My larger dogs just their center of gravity is always pushing down on their joints constantly. So getting adjusted in that way can help them, again, increase their quality of life, expand their longevity. So everyone needs it. I get a lot of questions on how often I should come or how often someone could come. So for Webster calls for once they hit about that 12-week period. For my moms, it's every other week. You come in and get adjusted, full spine and full extremity, unless someone doesn't want an area adjusted. But for the most part, I think that everything connects the body, all of it goes together. So I definitely think that covering everything from extremities to spine to, again, like the round ligament in the front or the sacrotuberous ligament from the back near your tailbone, all of that needs to be looked over. Even if you're not having those pains, we're trying to prevent it. So then when they get to around like 30, 32 weeks, it's once a week. Starting early with Webster helps your chances of not having to come in more often than what Webster calls for. I do have those moms that once they hit, that 35 to 38, they're like, oof, I'm feeling it. So then they have to do twice a week. But I usually only see that if they start seeing me at like around 30 to 35 or later. Then I'm like, okay, yeah, you got to come in more often.
Okay.
But if we start earlier doing Webster, again, preventing those symptoms from appearing, usually we just stick with Webster and what it calls for. So there's definitely a connection from that. My animals, my performance animals, so my horses, I is it this weekend? I think I'm treating some racehorses out in Woodland. So they're performing right now. And so I see them about every 3 to 4 weeks. And then on their off season, it's usually every 6 to 8 weeks.
Okay.
For my dogs, again, kind of the lap dogs, it could be like 6 weeks. And then for I treat a lot of like show dogs. So during their season or when they're about to travel for a lot of shows, it's usually maybe every like 3 to 4 weeks. So it kind of depends.
Okay.
And that's what I tell my regular patients too. Again, like maybe every 4 weeks for you. Some people need it sooner. Some people can go out longer, but I'm usually like once a month, let's get you adjusted.
Okay. Well, that's good to know. Very, very cool. All right. Are there any lifestyle or wellness tips you'd recommend for moms who want to maintain good spinal health, like past pregnancy? Like that doesn't maybe, come to visit and go to your chiropractor, as often as you need for things, but anything that they should be doing at home?
I mean, put yourself first, which is way easier said than done. But I'm always encouraging taking those moments, if it's going and grounding in your backyard by yourself or listening to a podcast, nourishing your body, of course, drink your water, get your vitamin D, get your healthy fats in there, get your lean proteins, your fruits, your veggies, of course, different things like that. But I'm like, just nourish your body. You're amazing. Like, I'm always telling my moms, like, you guys just did literally the coolest thing ever. So that's probably one of the biggest things is I try to tell my moms is take care of yourself as much as you can. Take those moments, of course, get adjusted, but listen to your body and just know that I'm here for you. You got a team. Take those moments for yourself. Yeah.
Oh, that's awesome. I love it. Yeah. Great. So throughout our conversation, we've talked about how chiropractic care, it provides essential support for pregnant moms, postpartum moms, newborns, animals. We talked about how adjustments can help with discomfort, improve birth outcomes, and then support the development of the infant all the way through their lives as well. So that was cool. We talked about how animal chiropractic care extends to all sorts of different four-legged or two-legged, I suppose, if it is a bird, because it could be two-legged also. All of our family members there too. So Dr. Taylor, before we wrap up, do you have any final words of wisdom or advice for expectant moms, new parents who might be considering chiropractic care?
Yeah. Just to reiterate, going to the ICPA website and finding a Webster Technique certified chiropractor in your area. Even if it's, I get a lot of, I can't afford to come in as often as, what Webster calls for. That's okay. Like, everybody's different. Come in when you can. Again, for me, like, I'm covering everything all in one visit. So we're not going to leave anything out. You're not going to get treated for one thing and then not another or something like that. So I still, am encouraging people to take that time for themselves, get adjusted when they can, pre or postpartum. See, any other words of wisdom? Get adjusted in general. I think that's about it. I just kind of live by like finding the things in your life that are going to increase your quality of life and just kind of make you a happier person. We have so many things that cause so many stressors.
Yeah.
Those 3 traumas, physical, mental, and emotional. If it's what's going on in the world with the news or what's going on at work or your family life, whatever it is, and take those opportunities to take care of yourself and not even selfishly put yourself first, but putting yourself first is going to help you with all your other relationships, with your kids, with your spouse, with your work. So I'm always, people come in feeling really bad, like, oh, I left my kid at home to come to this appointment, or I took this appointment, but my husband, like, do what is best for you. Like,
Yeah.
I'd say that all the time, and people are like, wow, how do you? I'm like, I try to live by it too, and it's hard, but try to do it.
You're right. No, that's a super good point. Yep.
Yeah.
We have to show up for ourselves before we can show up for others.
Sure.
Yep.
Right. Yep. Absolutely.
So, Dr. Taylor, where can our listeners find you if they'd like to learn more or perhaps book a session with you?
Yeah. So my business in Winners is called Renew Health Chiropractic. If you're familiar with Winners, it's just right in downtown Winners. Really easy to spot. My website's www.renewhealthchiropractic.org. All my booking is online. You can always give me a call. All my contact information is on my website, but booking is available online too through my website. You can go to my Instagram, Renew Health Chiro. My booking's through there. TikTok. What else do I have? Facebook, of course. Email is renewhchiro at gmail.com. If you have any questions or anything like that. I'd love to answer any of them.
Oh, that's wonderful. Wonderful. Well, thank you, Dr. Taylor, for sharing your expertise today. Your insights are really invaluable for parents and families navigating through this. I know you've sold me. Like, I think I'll be booking some time with you online.
That's awesome.
Thank you. And thank you to all of our listeners for tuning in. We hope this episode has provided some valuable information to help you or someone you know thrive in their pregnancy, postpartum, and beyond.
Yeah.
If you
Thank you for having me.
Yeah, thank you. It was really been great speaking with you. And I hope somebody listening will stop by to the Winters area and visit with you.
Yeah.
And for those listening, if you enjoyed today, please subscribe, leave a review, and share it with your friends and family who might benefit from these insights. Also, try and follow not only Renew Health Chiro on social media, but Together We Thrive Birthing Services as well. We are on Facebook and Instagram. We're not TikTok though, so I need to take a class on how you're doing.
That's what the kids are doing these days, so right? I'm trying to stay with it.
Right. Yep. Awesome. Thank you again very much, Dr.
Yeah, thank you.
And our listeners, stay tuned for the next episode, and we're going to dive into another important topic to support new and expectant moms. And until then, take care, stay well, and keep thriving.
Bye.